So before you registered for this program, how many of you knew what specialized pro-resolving mediators were? You matched the physician population. Nobody knows. The only people that know are physicians in Boston, because this was discovered by Dr. Charles Sirhan, who's the professor of pharmacology and medical biochemistry at Harvard University. He did that about 5 years ago. I read his seminal paper in Nature Medicine. And the minute I read it, I knew this was going to be easily a Nobel Prize eventually. So what everybody has been speaking about today can improve their results by at least 30 to 50%. So if you need any proof of what I'm going to say today is accurate and truthful and not hyperbole, you can go to my website, Dr. Melvyn Grovit. You can read 40 reviews of people I've treated. We have a large cohort of patients, physicians who were diabetic, lost arms, lost legs, couldn't heal their wounds, and we closed their wounds. So I want to share this with you, and I hope we can really change the profession, because medicine is not picking up on this. Boston is, but the rest of the world is not picking up on this. And it's really sinful. I have no conflict of interest to report, despite the fact that I am so enthusiastic about what I'm going to be talking to you about. It almost sounds like I'm a salesman for them, but I'm not. I accept no fees from any nutraceutical company. So these early slides that I'm going to show you here are actually from Dr. Sirhan's publications. So specialized pro-resolving mediators, SPM for short, they can eliminate, you heard me right, eliminate inflammation and take a condition to its full resolution. I'm talking about something that is a miracle nutraceutical. You can make them endogenously, and there are 4 classes: lipoxins, resolvins, protectins, and merisins. And they're derived from essentially fish oil. But the amount of SPM that's in fish oil is the amount that you would find in a head of a pin. If you take out the SPM from fish oil, the only function fish oil has at that point is cellular membranes, keeping them flexible. So I can recall one child, and this is pretty much how my practice goes. A mom had my card in her pocketbook for 1 year, and then she relented and came to see me. I had to tell her that I could no longer really treat her child because he needed a colectomy. His colon was necrotic. We sent him to Mass General Hospital, and they performed a colectomy. Because it was Boston, it was done under the influence of SPM. Dr. Sirhan's recommendations for SPM were 1,000 milligrams a day. I give this child almost 3,000. He was discharged from the hospital in 5 days. 7 days later, he was walking his dog. Virtually, externally, completely healed, but of course, it would take a year for the inside to be healed. So essentially, when you take a fish oil capsule, you're hoping it's going to be anti-inflammatory. SPM, the concentrate of what's in fish oil, will absolutely eliminate the inflammation. There was an article in National Geographic about 3 months ago. And the title of the article was, "Is inflammation about to be eliminated?" And the conclusion was, it may well be. And lo and behold, specialized pro-resolving mediators may do this. So it's known all over the place. It is not used by except in Boston. Oops, I went backwards. Sorry about that. So basically, we have two situations. You have the initiation of inflammation and you have resolution of the inflammation. So SPMs control excessive, and we need inflammation. We need to know that if you're a diabetic and you kick something, you need to know that perhaps you have a nail in your foot. It limits polymorphonuclear cell migration to the inflammation site. I cut this thumb down to the bone 5 days ago. There's no scar. I took about 6 SPMs every single day. Dr. Surian says too. There are many reasons why physicians may not be using this, and I can't begin to hypothesize why they wouldn't, but they just don't. Excuse me. So SPMs counter pro-inflammatory activity, there's no question about it, and it limits tissue damage. And what you're looking at all day today is tissue damage. And what I've learned in these 60 some odd years in podiatric medicine is that we all we're gung-ho for these surgical procedures that 20 years later we apologize for. Our techniques are getting better. We're getting more recognition. The training is better. I can't believe the college when I went through it the other day. I just cannot believe the advances in the physical plant. And now the affiliation with Touro University. So things are getting better despite the gloom and doom of what the pandemic has done to us. It's destroyed our youth. Absolutely destroyed them. They're socially inept, and they just don't know how to behave because they've been isolated for 2.5 years. So part 2 of this has to do with the resolution of inflammation. They actively promote resolution of inflammation. And you'll see what I'm getting at shortly. So there are 2 kinds of macrophages in the body, M1 and M2. M1 participates in the inflammatory process. M2 participates in the resolution. And what I'm telling you is that you can effectively cure a disorder. So you get this enhanced macrophage phagocytosis, it clears up cellular debris, shortens time to resolution. Things heal quicker than you could begin to imagine. The increased production of anti-inflammatory mediators and the killing of and clearance of microbes, this nutraceutical is capable of dealing with viruses, with yeast, with cocci. I'll tell you some stories that you're going to not believe, but I'm going to ask you again, please go to my website, drmelvyngrovit.com, and you'll see words from the patients, because these facts are true. When I was sitting with Dr. Truppel yesterday, I got an email from a patient of mine in India. The last sentence, she says, "You cured my son. Please save my mother." And I'm not so sure I'll be able to do that, but I'll tell you what I'm going to do. I'm going to try, because there's nothing to lose. I'm not afraid of being sued. I've never been sued. Not even gotten a lawyer letter. So I'm in the business of finding the pathophysiology and the pathochemistry of all disease. I get cooperation from physicians because I'm known as the last resort of nutrition. So they figure they have nothing to lose. So if you don't get resolution of a problem, you have chronic inflammation. I think we know that. When you look at the left side of this slide, you see there's a balanced response, initiation, and then followed by resolution. You don't get that in the right hand of this slide. There is no resolution. So what do you do when there's no resolution? You resort to some very powerful drugs. Prednisone, Humira. I can understand if we go back in time to the time of heart transplants, kidney transplants, liver transplants. We immunize those people. I'm sorry. We immunosuppress those people because we had to. That was the only option that these people had to stay alive. But now we have a situation where I don't care what the illness is, the offer you get is a monoclonal antibody to immunosuppress you. And is it any wonder that we now have a resurgence of polio and COVID and monkeypox? And Lord knows what we are doing to this planet in terms of immunosuppression. So I've taken a different path. I want to strengthen immune function and not suppress it. That's probably why I've been successful at what I'm doing. So anti-inflammation is not pro-resolution. You must understand that. Conventional anti-inflammatories like Saloxibid, they'll reduce the magnitude of, anybody with arthritis can tell you, take any one of the non-steroidal anti-inflammatory drugs. It relieves the pain. What happens when it wears off? You take another one, and you keep taking them, and eventually you have a gastric ulcer, and eventually you have kidney disease, and eventually you have Crohn's disease, because that's an etiological factor in each one of those illnesses. So it doesn't, that particular form of therapy does not take care of inflammation the way you'd like to. How can we get more lipid mediators that work for us as immunostimulants? It's very simple. Give up your love of red meat, which is destroying you, and start embracing a Mediterranean diet. More fish from healthy waters, as long as we have them. So as you see at the bottom of the slide, those SPM molecules come from fish. And what you have from meat is pro-inflammatory activity. So COX inhibitors blunt resolution, but they do nothing whatsoever for getting rid of the cause of the problem. Now, everyone here today so far has said the same thing. Let's find the cause of the problem. The cause of the problem is in the cell, but we're not used to thinking that way because we deal with macro. We deal with what we see in front of us. I deal with cellular metabolism, and I can show you some of the things that I've done. And when you see them, you'll say, that's not possible. And I'll provide you the proof. So SPMs are not immunosuppressive. And these are Dr. Sirhan's own words. So when you have an infection from Candida albicans, the yeast is dealt with by SPM, in addition to other things. You must understand something. SPM is sort of at the bottom of the period here. You have that in place, and then all your other therapies layer on top of it. John talked about hyperbaric oxygenation. I took a physician who could not close his amputated stump. He absolutely could not close it. He's been to everybody. Now, because of his illness, his limitations of practice left him to be a psychiatrist. And so he would help in palliative therapy in California. I sent him for the HBOT, and I put him on a very high dose of SPM and a special cannabinoid that I designed. He healed in 3 months, and he still healed. No physician could close that, including the specialists at UCLA. As you see, E. coli, Staph aureus, sepsis. One of my friends called me and said, I have 103 fever. My abdomen is killing me. Could you take a look at me? I said, you need your physician. You don't need me. Just take a look. So I pressed on McBurney's point, and I said, you need your physician. You've got appendicitis or else acute ileitis, one of the two. She couldn't get him that night. She got him the next morning. He examined her, sent her immediately to White Plains Hospital. Upon admission to the emergency room, her appendix ruptured. She now had peritonitis. She took a bottle of SPM with her, and against all physicians' instructions, nothing to be taken in the hospital other than their stuff. She followed it up with 6 SPM a day. Discharged in 5 days. Full-blown peritonitis gone in 5 days. I didn't even believe it myself. It's not responding. Oh, there we go. So here we talk about the macrophages. I mentioned the M1 and M2. This graphic explains it very clearly. The function of an M1 is antimicrobial activity, reactive oxygen species production, unfortunately, but it does engulf pathogens. And what you see in the bottom left is that free radicals are generated during that inflammatory process. And so something needs to be done to move this and shift the SPM from an M1 phenotype to an M2. And when you shift to an M2, you immediately get interleukin 10, TGF beta, VEGF, and PDGF. And you have the healing process taking place. Where does SPM, my father-in-law used to ask me, if I take this pill, how do I know it's going to go to the place where it's needed? And the answer is very simple. It goes everywhere. So if you have 5 conditions, when you take SPM, 5 conditions are being treated. I had my intestine operated on in Mount Sinai in the late 60s. I had 18 feet of my intestine removed. I'm standing in front of you with 8 feet of intestine. I was told I'd be dead by 21. The only thing that happened is those 6 or 7 physicians are dead, and I'm standing before you right now. When somebody tells me it can't be done, I will go out of my way to prove to you that it can be done. When I show you one slide with a list of conditions that I treat on a daily basis, you'll understand why I'm a zealot when it comes to SPM. It covers everything from the tip of your head to the tip of your toe. And notice the last thing on the left, peripheral arterial disease. I was admitted to the hospital with angina about 25 years ago. 40% of one carotid, 20% of another, and 2 were open. So I know what the pain is like. I gave my Doppler to my cardiologist about a month ago. I have documented PVD at the New York College of Podiatric Medicine from a vascular specialist. He handed me back the Doppler and said, both your pulses in both feet are fully patent, triphasic, no PVD. America is really in bad shape. I mean, the obesity in this country is intolerable. 95% of all diabetics type 2 are obese at the time of diagnosis. And that portends to be a pretty serious burden on our healthcare system. And when I show you what can be done to the healthcare system, we should be screaming at our legislators that they're missing the boat. So obese patients do not make SPM the way they're supposed to. So the presence of an SPM deficit and an impaired capacity to make it in adipose tissue, it just doesn't allow for resolution of the inflammatory process. And you can see this very capably demonstrated in Dr. Sirhan's graphs here. Metabolic syndrome. We know that's a big problem. The android distribution of fat that we see in men, you just have to look at a man and know that that's a ticking time bomb. You need to have SPM to keep up with these pathophysiological changes that have occurred. And it seems like every profession, podiatry, you heard somebody say SAD. Guess what? The American diet is SAD. That's an acronym from Standard American Diet. You eat the Standard American Diet and you will die prematurely. For women, not having enough SPM is a disaster because it just absolutely fosters more endometrial tissue. You've heard women's abdomens being filled with endometrial tissue, and that's because there really is a deficiency of SPMs endogenously. The original studies were done on healthy volunteers at Harvard. They were done with subjects that had peripheral arterial disease and subjects with chronic pain. Patients with fibromyalgia were omitted from the study. I have cured fibromyalgia. It is a defect in glycolysis and energy production. And I did that at Columbia University Medical Center, where I was there for about 10 years in the Department of Genetics and Metabolism. SPM starts working within 24 hours. Within 2 weeks, it's on board. Within a month, you will see the results. You will feel the results. This is a slide about peripheral arterial disease. It gets into plasma and HDL particles, reduces M1 inflammatory markers, increases M2 resolving markers, everything that we said before. And more importantly, it reduces the adhesion molecule expression on white blood cells. They can't adhere and produce the deformity and the inflammatory process. Now, this is what I did for the past 3 years during the pandemic. While we were all bemoaning our lot in life, I decided to learn whatever I could about cannabinoids. And what I learned about cannabinoids is an American tragedy. In the late 1890s, John D. Rockefeller, this is an established fact. You can find this in any history book. John D. Rockefeller and the founder of Eli Lilly, the company, Eli Lilly, conspired with someone, we don't know who, in the United States government to make CBD illegal because Eli Lilly discovered that this thing called weed healed an awful lot of lesions in the body. And there was no such thing as a pharmaceutical company at that point. And so John D. Rockefeller, Eli Lilly, and the fellow that owned the Philadelphia newspapers, Philadelphia Inquirer, etc., somehow got somebody in the United States government and made CBD illegal. CBD came into its own about 3 years ago. My brother-in-law, who happens to be a world expert in the area of CBD and pain management, finally got through to me because I rejected it for years because there wasn't enough scientific evidence. And I bought it hook, line, and sinker to the point where I started designing some of this stuff for my needs, which was inflammatory bowel disease. So this may shock you, but this is the truth. When I give, and of course, people with Crohn's disease or any inflammatory bowel disease, ulcerative colitis, ascending cholangitis as a result of it, lymphocytic colitis, you can go on with indeterminate colitis. These are all people who have malabsorption. They got arthritis. They got eye problems. It's a debilitating, destructive disease. I would never want my name associated with that disease, except as somebody who really found a cure for it. In my hands, and I noticed this in podiatric medicine as well, when I was a student at the Ohio College of Podiatric Medicine, there was a surgeon by the name of Ray Supan. And he did a certain procedure, got great results. Everybody else that did it got terrible results. And it was written up as a failed procedure. Now I come along with SPM and the cannabinoid that I designed for Crohn's disease. And I put 87% of the patients that came to me, and that number right now is 637 as of yesterday, into remission. 87% by immunostimulation, not immunosuppression. Not $22,000 a pop. Peanuts compared to that. So this is not immunosuppression. This is immunostimulation. I got COVID. My wife got COVID. She went on for 10 days. I went on for 5. A guy with 8 feet of intestine and all kinds of issues. Now, this is the slide I want you to see. The conditions that I treat, personalizing them for each person's situation. We are not all the same. We may look the same, we may give the history of being the same, but your genetic predisposition, your environment, your way of eating, your drugs you're taking, the doctor that's taking care of you, all have influence on your general health. Let's look at the first one, autism. 7-year-old child is brought to me by his mother, whom I treated this child about 4 years ago. Got rid of his Crohn's disease. And then she makes me suddenly aware that after I did that, he was exposed to shingles. And he immediately developed autism. He became a self-mute, didn't say a word for 4 years. She called me one day and said, "Can you do something for this?" And these are the calls I get all the time. "Can you do something like this?" And I said, "Well, I'll try." The first month of administering certain nutraceuticals, he learned 90 words. You know what they meant? The first sounds that he uttered in that month was ba 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 ba, just like that. As of this week, and now he's under observation by the American Autism Society. He now has 400 words that he states with clarity. The first time his mother asked him to speak to me, self-mute, the first thing he said was, no, gamma. He wants to stay with his grandmother. And the last time I spoke to him, he told me they're too strict at school, and he has to say, no, and they stop. This is an autistic kid that is now coming out of his autism. He's considered one of the fastest changing children that they've ever seen. I spent 10 years at Columbia in the Department of Genetics and Metabolism. Pompe disease is a very complicated disease, and I mentored under a man by the name of Alfred E. Slonim. Dr. Slonim was a world authority on glycogen storage diseases and Pompe disease. They made a movie about him, and he took me to Columbia. What happened at Columbia was I used to get their IBD patients better. And one day when I gave a lecture to the pediatric nutrition department at the baby's hospital, when the chief left, they asked me to stay and tell them, I'm supposed to tell them how to treat ulcerative colitis in a child. It's a big mystery why diet has not made its way into the physician's armamentarium, but I suspect it's the AMA's fault. There's no room in a medical curriculum for something that takes an hour on the first visit. There's just no room for it. Genetics came along, and that filled all the slots right there. So I understand it, and I can't blame physicians. What I will blame them for is saying nutrition has nothing to do with illness. That is false, and as far as I'm concerned, it's an act of malpractice. It is so in the fact that a hospital administrator fired the chief of gastroenterology because of what he said about me. So if you look down this list, vascular insufficiency and wounds, you won't believe how fast wounds will heal if you use your good skills and add SPM and, if possible, cannabinoids. But you don't have to use the cannabinoids. You have to know something about cannabinoids before you start using them. Chronic fatigue syndrome, we took care of at Columbia. Alpha and I were able to solve that one. Now the next one, even Dr. Trouble had trouble listening to me with this one. But I have proof. I can put somebody in remission with diabetes type 2 within 3 months. And if they follow what they're supposed to be doing, no smoking, watch their weight bearing, see a podiatrist, have the proper care, eat properly, they will never be bothered by diabetes again. But they have to follow those instructions. It doesn't help to go to the fire department after you purposely burned your house down. And that's what people do with diabetes. They smoke, they drink, and they don't eat a proper diet. And what is so terrible about a Mediterranean diet? So if you use CBD and CBDA and THCV, you have a combination that will drop a blood sugar anywhere from a month to 3 months. Documentable. I can prove it. I did it to my wife. Somehow at Columbia, we got involved in chronic fatigue syndrome, and we started doing brain MRIs. And we noticed something. We noticed that there was lactic acid in the vacuoles of the brain. So we used to have this pulmonary lab when I was there, where Olympic athletes would come. And if you know anything about Olympic athletes, 1/100th of a second is the difference between winning and losing. So we used to test these athletes. Excuse me. So Alpha and I developed a protocol where we would run these athletes who were having chronic fatigue issues and other people who had chronic fatigue. We'd run them up and down the stairs that led to the pulmonary lab 5 times. And we had a lab tech immediately draw blood on them. And every single one of them with chronic fatigue had lactic acid levels that were abnormal. And that led us to the physiological possible etiology of chronic fatigue syndrome. And today, that doesn't exist in my practice. People come for this, we get them cleared up in a month or 2, providing they listen to the dietary restrictions. Peripheral neuropathy, I have proof of this also. From 6 inches above the ankle, you can clear this up within 1 year, completely, on a high dose of SPM. And if you really want to ensure success, all you have to do is add a certain group of cannabinoids at the same time. So you look at this whole list, and you're going to be told that there's no solution. Let's take kidney stones, for example, very common in Crohn's disease. I was told by, I can't tell you how many urologists, you got to watch your calcium. You shouldn't be eating calcium. That is absolutely hogwash. Oxalic acid is a small molecule, easily absorbed. But if you have oxalic acid in the presence of calcium, you make calcium oxalate, which is a large molecule. And large molecules are not easily absorbed. So I was given the exact opposite of the advice that I should have been given. I also tested my urine. I discovered my citrate level was almost 0. When I started taking magnesium citrate, I got rid of 17 stones. This is all through applied nutrition, which I've been teaching at the college for I don't know how many years. So we need to revisit what works in our profession and what hasn't worked, because now maybe it will work in the presence of SPM and cannabinoids. And that's a good thing to revisit. And I'm going to show you a slide on what you can do to arterial disease. Salvia miliarizia in Chinese, it's called dashen. It's been on Earth 2,000 years. It corrects endothelial dysfunction. It'll drop your blood pressure like a rock. It can alter the clotho gene in your kidney to sufficiently improve chronic kidney disease. And it costs about $20 a bottle. Excuse me. Grapeseed extract can also perform miracles on your endothelial dysfunction, but there's one problem with it. It does have an anticoagulant effect. So anybody taking any one of the anticoagulants or antiplatelet drugs cannot take this. Vitamin C is, ever since Linus Pauling put it out there, his mistake was relying too heavily on the word cancer. Cancer is a word you don't want to say you have a cure for. I had a treatment for it. I said it once and I'll never say it again. As far as I'm concerned, it's for my family or anybody else that wants it. But when you start talking about doctors, about manipulating the metabolism of cancer, you're going to find you have a target on your back. And so I learned that lesson real early. I don't have a cure for cancer, but I do have some things that can make life a lot easier. The tocotrienols are a family of vitamin E isomers. They're very important in protecting cellular membranes and the cells themselves. And so with the isoprenoid arm of the structure of vitamin E, alpha-tocopherol, it reaches into the cell, latches onto reactive oxygen species, passes it out extracellularly to vitamin C, and vitamin C takes it and disposes of it. So these reactive oxygen species can be managed very easily with a combination of antioxidants. Red sage also, in my research, has proven to be a very effective antagonist to osteoporosis. I never expected that. 2,000 years old. And yet, we rely on things that cause all kinds of side effects. So here's a personal anecdote as well. I brought my endocrinologist, well, he's a nephrologist. He's the best Columbia has to offer. And I've known him for years. I was on a staff there. We have data on me. I had osteoporosis of my spine 10 years ago, osteoporosis of my hip, same time, and minus 4.5 on my left wrist, which they allege is the standard. So, osteoporosis. Last year, I had a repeat on the same machine, same doctor. He sent me the report. The report said, your spine is normal, your hips are minus 1.2, your left hand is minus 4.2. So I said, Dr. Nicholas, why do you say I have osteoporosis? He said, because the left wrist, it went from minus 4.5 to minus 4.2. I was taken back by that. So I said, supposing I came in today with today's results, what would you say I had? He said osteopenia. And, I don't like embarrassing friends. And I said, okay. Now, how can I have osteoporosis 5 minutes before and osteopenia 5 minutes later with the same data? They don't expect people to get better. They don't see results that I deliver for patients. I work with physicians. I'm not a rogue. But they're not used to seeing people get better. That really is what it's all about. Now, one of my colleagues and good friend is Ananda Prasad. He wrote the book on zinc. And I can tell you another personal story about him. I was admitted to Columbia with an intolerable case of dizziness. I couldn't stand. To give you an idea, I was in there for a whole week. They couldn't find anything wrong. And when my wife went to get the car, she literally took her raincoat belt and tied me to a telephone pole. That's how disturbed I was. And I had just read Anada's book. And I said, Linda, we have nothing to lose. Let's take a shot. Take me to the health food store. I'm going to buy some zinc. I bought a 22 milligram tablet of zinc, broke it in half, took 11 milligrams, and 20 minutes later, the dizziness was completely gone. That's when I learned that short bowel syndrome has some mineral problems. And I started pursuing that research. And then when my brother-in-law finally convinced me that I needed to know about cannabinoids, I relented and I studied with him for 3 years. And so then I started developing my own combinations. And that is something I just can't even believe that went this many years before it became legal. Now, my fear is the uneducated will be doing stupid things like trying to cure cancer or trying to do whatever they can without any education. It took me 3 years to get a handle on this. So I don't expect anybody to do this in a very short period of time. Curcumin was first developed by Dr. Brett Agarwal at MD Anderson Cancer Hospital in Texas. And the disagreement about curcumin was that it was poorly absorbed. And so now we have curcuminoids that are 100% absorbed. The downside of that is it does affect platelets. So if you have anybody on any anticoagulant or antiplatelet therapy, curcumin is not a good choice. But for a mild case of arthritis, curcumin and boswellia are outstanding with none of the baggage that comes with nonsteroidals. Do you know how old boswellia is? I'll mention one word and you'll know exactly how long it's been here. And the word is Jesus. That's how long this has been around. And we still have a fascination with Advil. So in summation, there has to be a balance between what is a normal amount of inflammation and normal production of SPM and the various inflammatory conditions we're exposed to. If each and every one of you, starting as soon as you can, started taking SPM, now Dr. Surian says 2 a day, I routinely use 4 a day. If you started doing that, your health will jump beyond your wildest imagination. It is incredible what SPM can do for people's health. So you, your families, and your patients, most importantly, their ability to heal in some of these horrible cases that you've been looking at is going to go up exponentially. So as far as I'm concerned, they should put this in a drinking water. Now, I apologize in the beginning because I'm a zealot about this, but I cannot believe why no one knows about this except Boston. So I think that's pretty much it. I'd like to thank Dr. Truppel and Dr. Axman for inviting me.